I really appreciate the opportunity to be here with all of you today. So welcome everyone to Alignment Health Plan's Medicare and You presentation. So this is a Medicare focused presentation to make sure that you have the information that you need, as well as answer any questions that you may have about Medicare and your options. Again, my name is Eva Mendez, and I am the corporate sales trainer for Alignment Health Plan. Now, we want today's call to be interactive. We also want to make sure that you get all of your questions answered. So at any time, please feel free to use the chat feature to ask a question, or if you dialed in, we will answer the questions at the end of my presentation. So if you're in the process of deciding how you're going to be receiving your Medicare benefits, or you're just doing some health insurance research for a loved one, you've no doubt noticed that there are a lot of coverage options. At Alignment, we want to keep things simple and easy. So on the call today, we are going to break down the basics of Medicare coverage. So let's go ahead and get started. Now, Alignment Healthcare has created a new model of healthcare by focusing on one simple fundamental belief: to put the senior first. This simple, fundamental belief has transformed into the advanced healthcare approach that we feel is unlike any other. Alignment Healthcare offers healthcare options to over 80,000 members through Alignment Health Plan. Our members experience a new level of care that puts them first. We are here for our members 24 hours a day, 7 days a week, 365 days a year, ensuring that they receive access to VIP level of care and service without those high VIP costs. So let's first start by identifying what is Medicare and who is eligible for it. Now, Medicare is a national health insurance program in the United States, which officially began in 1966 under the Social Security Administration and now administered by Centers for Medicare and Medicaid Services, or what we refer to as CMS. Medicare is a federal health insurance program for people who are age 65 and older, certain people under 65 with disabilities, people with end-stage renal disease, and a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. Now, before I break down the different parts of Medicare, I just wanted to share a fun little trivia with all of you. Did you know that on July 30th, 1965, President Lyndon B. Johnson signed into law legislation that established the Medicare and Medicaid programs? President Johnson signed the Medicare bill at the Harry S. Truman Library in Independence, Missouri, with President Truman seated right next to him. You see, 20 years earlier, President Truman had proposed his idea for nationwide health care, and Truman was the very first recipient to receive his Medicare card. Over 50 years, these programs have been protecting the health and well-being of millions of American families, saving lives and improving the economic security of our nation. Okay, so let's go ahead and get started. When can you enroll in Medicare Advantage plan or a prescription drug plan? Well, upon turning 65, you have an initial enrollment period, which is actually 7 months long. It begins 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65. Now, if your birthday happens to land on the very first day of the month, it actually begins and ends 1 month earlier. You may enroll in Medicare Part A, Part B, or both. You can also choose to join a Medicare Advantage plan, also known as a Part C, or a prescription drug plan known as a Part D. Now, every year there is something called the annual election period, AEP. It starts on October 15 and it runs all the way through December 7. During the annual election period, you can add or change your Medicare coverage. This is the opportunity that you have to shop around and make the best choice for you for the following year. Now, for those that chose a Medicare Advantage plan during AEP, you will now have an annual election period. And you have your annual election period, And every year, there's also the Medicare Advantage Open Enrollment Period, referred to as OEP, which means that during January 1 through March 31st, you have a one opportunity to either disenroll from your current plan and switch to a different Medicare Advantage plan, or you can revert back to just plain old original Medicare and choose a prescription drug plan, that Part D. Now, there is also a special enrollment period. These periods are outside the normal enrollment periods where you may be able to enroll into Medicare plans. Some ways that you qualify for a special enrollment periods are if, number one, you retire or you lose employer coverage, whether it's voluntary or involuntary, you move in or out of your service plan area, you receive assistance from the state like Medicaid or Medi-Cal, you've been diagnosed with certain qualifying disabilities or a chronic health condition, or if you qualify for extra help, also known as a Medicare Savings Program. Now, after you enroll in original Medicare Parts A and Parts B, there are two ways to receive additional coverage. So if you're deciding between just original Medicare and a Medicare Advantage plan, here are some key things to keep in mind. But first, let's talk about what they cover. So original Medicare helps cover hospital and doctor visits. You will pay a monthly Part B premium of $148.50, $148.50. That is the rate in 2021. You may also pay a Part A premium if you did not pay enough Medicare taxes while you were working. So when it comes to seeing doctors, original Medicare usually covers about 80% of the medical services, which may require a 20% coinsurance. So beneficiaries like yourselves may be responsible for paying 20% of the total bill based on the final bill, and ultimately, it can make planning ahead a challenge. Also, since original Medicare does not cover prescription drugs, members can purchase a Part D prescription drug plan for an additional premium. Now, let's talk about what a Medicare Advantage plan covers. Medicare Advantage plans include Part A coverage for hospital, Part B coverage for your medical benefits, and most plans also include your prescription drug plans, that Part D, all bundled up. Many Medicare Advantage plans also include additional coverage such as routine dental, vision, hearing care, benefits that are not typically offered by original Medicare. Now, cost is also an important factor when you're considering your Medicare options. You'll want to understand if there is a maximum out-of-pocket cost guarantee. Now, the maximum out-of-pocket cost, referred to as a MOOC, is the most that you are responsible to pay in a calendar year. Co-pays for doctor visits and hospital stays count towards that maximum out-of-pocket. Now, most Medicare Advantage plans have a maximum out-of-pocket, so look at it as a safety net. Once you've reached this amount for the year, your insurance company, like Alignment Health Plan, pays 100% of the covered services. Now, remember, with original Medicare, there is no maximum out-of-pocket cost guarantee, so there is no limit on how much you'll have to spend in a calendar year. So again, it just makes it very difficult to plan ahead. Now, Medicare Advantage plans, it's just plain and simple. They do give you more. Look at the coverage that you'll be getting from a Medicare Advantage plan. Hospital stays, some medical care such as doctor visits, preventative services like flu shots, prescription drugs, routine vision coverage, routine hearing exams, hearing aid coverage, and again, there is no limit on your, again, it limits your annual out-of-pocket cost. Now, as I mentioned earlier, Medicare Advantage plans include Part A for hospital and Part B, your medical benefits. And most plans also include prescription drug plans, the Part D. Many Medicare Advantage plans also include coverage for worldwide emergency care, annual physicals and screenings, and benefits, again, that are not typically covered by original Medicare. Now, there are only a few requirements to join a Medicare Advantage plan. First, of course, you must be enrolled in original Medicare, so you must have that Part A and Part B, and you must live in our plan's service area. That is it. Now, Medicare Advantage plans for those with special needs. There are special types of Medicare Advantage plans called special needs plans. These plans include focused and specialized health care coverage for specific groups. Dually eligible plans for those with both Medicare and Medicaid is one of them. A chronic condition plan for those with certain ongoing medical conditions, such as diabetes or cardiovascular disorders, or someone that's institutional. There are institutional plans for those living in nursing homes. Now, Alignment Health Plan has special needs plans for those that are diagnosed with diabetes and or a heart condition. These plans are available in Los Angeles and Orange County. We also offer a dual eligible special needs plans for the individuals who are entitled to both Medicare and Medicaid assistance from the state plan under Medicaid, and they are available in Stanislaus, San Joaquin, and Marin counties. One important thing to know is that for the special needs plans, you actually can enroll in these plans year-round. Now, important things to know about choosing a Medicare Advantage plan. So once you enroll in a Medicare Advantage plan like Alignment, first and foremost, you must continue to pay your Medicare Part B premium. Then what Medicare does is then gives that premium to the health plan like Alignment Health Plan to pay for those additional benefits. Number two, joining a Medicare Advantage plan may affect your current coverage. So if you have existing coverage or employer-sponsored health insurance, the plan that, if you plan to work past 65, you definitely want to check to see how joining a Medicare Advantage plan could affect or even cancel your current coverage. Also, it's best to use network providers. The use of network healthcare and pharmacy providers outside of the network may actually cost you more. Just also keep in mind that in an emergency, you can use any provider. But generally speaking, when you join a Medicare Advantage plans, you will be using the network providers. Number four, you may qualify for financial assistance. So depending on your financial situation, you may qualify for extra help that will help you pay your Part B premiums, also your Part D medications through the low income subsidy, or also known as extra help. Number five, if you enroll in Part D late, you may pay a penalty. This is an additional amount charged by Medicare that will be added to your Part D premium if you go without Part D coverage for longer than 63 days in a row after your initial enrollment period. And we talked about that. Now, a Medicare supplemental insurance plan, a Medigap plan, it's not a Medicare Advantage plan. So understand the difference between a Medicare supplement insurance policy and a Medicare Advantage plan. A Medicare supplement plans are health insurance policies and are secondary to original Medicare. A Medicare Advantage plan combines original Medicare, the Parts A and B, and sometimes the Part D in one single plan. Now, number seven, keep your member ID card handy. So once you join a Medicare Advantage plan like Alignment, members must present their Alignment Health Plan member ID card when they receive services, not their original Medicare card. Now, number eight, Medicare Advantage offers the same protection as original Medicare. So this is important. So even though Medicare Advantage plans are privately administered, you have the same rights and protections as original Medicare. Number nine, Medicare Advantage has, of course, you covered. Medicare Advantage plans must cover all of the services that original Medicare covers and may offer additional benefits that we talked about. But one thing I do want to mention is that hospice care is not covered under original Medicare. You may also receive benefits if you have TRICARE for life or veteran benefit coverage. Number 10, again, you have a built-in financial safety net when you're choosing a Medicare Advantage plan. Your plan's annual out-of-pocket maximum is, again, your safety net that ensures that you'll never pay more than a certain amount of out-of-pocket cost at any given plan year, and again, for covered medical services. Okay, so understanding prescription drug coverage. Again, it's that part D that we talked about. Now, if you're taking medications, you certainly know that that cost can add up. You may have heard of the term the donut hole or the coverage gap. The donut hole, again, it is a gap in your prescription drug coverage where you may pay for your prescription drugs. In 2021, the coverage gap begins when you reach the Medicare's Part D initial limit coverage, which is $4,130, which includes the cost and the retail cost of your medications and ends when you spend $6,550 out of pocket, at which case you will exit that donut hole. One thing to know is if you do qualify for that extra help or the low income subsidy that Medicare offers, it does pay your Part D cost, and the gap does not apply to you. So again, just a perk by qualifying for LIS. Now, here are some drug definitions we'd like to share with you. Some just things that you probably should be familiar with. Pharmacy network, what does that mean? So Alignment Health Plan has over 65,000 network pharmacies across the country. To receive these benefits, you must, of course, use an in-network pharmacy and show your Alignment Health Plan member ID card. You may receive additional discounts on your prescriptions by using a preferred retail pharmacy or by using the mail service pharmacy and having your medications delivered to your mailbox. Now, we do again have preferred pharmacies and retail pharmacies. So preferred pharmacies, generally speaking, is going to be the most bigger chain companies such as Walmart, Walgreens, Rite Aid, Costco, or Good Neighbor. If non-preferred or retail pharmacies, the bigger chains would be very simple, Target and CVS. Now, drug formulary list, it's a drug list, and it's a list of drugs that the plan covers. Each plan has their own, put together drug list. Tiered formulary, what does that mean? Many plans use the tiered formularies to group drugs together according to cost. So you'll become familiar with what does tier 1 medications mean. It just means that they're preferred generic drugs, usually the very lowest tier cost. Tier 2 would be your standard generic drugs. The tier 3 would be the preferred brand name drugs. Tier 4 would be the non-preferred drugs. Tier 5 would be the specialty drugs. Tier 6 would be the select care drugs. So when you're looking at your medications, they'll fall under one of these tiers. Step therapy. So one way Alignment Health Plan can help you save money on your prescriptions is by offering, of course, the lower cost drugs that can treat the same medical condition as your current brand name drugs. You may be asked to try one or more of these lower cost drugs before the plan will cover the brand name drugs that you are currently taking. Quantity limits. Some drugs have quantity limits. Where the plan will cover only a certain amount of drugs for one copay or over a certain number of days. The limits may be in place to ensure safe and effective use of the drug, so it's for your protection. However, if your doctor prescribes more or thinks that the limit is not right for your situation, it's okay. You and your doctor can ask the plan to cover the additional quantity. That brings up prior authorization. So before the plan will cover certain drugs, it may need more information from your doctor to make sure that the drug is being used correctly for the medical condition covered by Medicare. You may be required to try a different drug before the plan will cover a prescribed drug. Okay, so asking for an exception. So if you need a drug that is not covered on that drug list, you may do a couple of things. Number one, you may ask the plan to cover your drug, even if it's not on the drug list. This is known as a formulary exception. You may also ask to waive the coverage restrictions or limits on your drug. This is known as a utilization exception. Now, coverage decisions. If your doctor has submitted an exception request on your behalf, generally the plan will make a decision within 72 hours. However, you can request an expedited or fast decision if you or your doctor believes that your health requires it. Okay, so our enrollment booklets are available to all of you and are designed to provide useful information about Medicare Advantage plans. So the information that our booklets include are the benefit highlights, the summary of benefits, the drug list, which is also known as a formulary, ready to enroll instructions, plan information, and of course, required information. Now, you may know that 2021 for Alignment, it is a very exciting year, and also for our future members. We have expanded now, and we have a footprint in 22 markets across 3 states, including 2 new counties in California, including Ventura and San Luis Obispo. We've also expanded to Las Vegas, Nevada. And in North Carolina, we've expanded to Wake, Chatham, and Johnson counties. We also have new medical groups that have been added. For example, in San Diego, we are now including Scripps. And we also have Brown and Tolan in San Francisco, Meritage in Marin counties, and Memorial Care here in Orange County. We've also added new benefits for qualifying members in select plans, such as the personal emergency response system. It's that little lanyard that you can push a button in case you fall. We also have personalized health screenings, pet sitting, pest control, air purifiers, and so much more. Now, in select counties, we've also launched our AVA HMO plan. So it is a virtual first Medicare Advantage plan that offers a 0 copayment for your virtual PCP visits. It's a 0 virtual specialist visit copayment, 0 for your labs, 0 for your generic preferred drugs, providing greater flexibility and very low cost to our members. It even comes with a $100 OTC allowance, over-the-counter products allowance, that our members can redeem, even using, for example, if they want to receive an Apple iPad or an Apple Watch, or pay for their cellular plan. Again, this is just another way that we're taking senior care to the next level. Now, I know I've shared a lot of information with you today. We would be happy to provide you with enrollment kits that contain really valuable information. For example, our phone numbers, our hours of operation, and of course, the details about our plan. It also includes our website, our star rating, the summary of benefits, like I mentioned, a description of our yearly contract with CMS, which is Medicare, and of course, a multi-language interpreter service form. Now, we invite you to visit our virtual booth to speak to one of our friendly representatives today from 9 a.m. to 4 p.m. And you can even set up an in-person appointment if you prefer. Or if you'd like to visit us, you can visit us via website. Our website is www.alignmenthealthplan.com/planinfo. Again, let me repeat that. Our website is www.alignmenthealthplan.com/planinfo. Now, or if you feel that you really would like to speak to someone at a later time, you can always call one of our friendly alignment representatives. And let me go ahead and share that phone number with you. That phone number is 888-583-4007. Again, you can always call one of our friendly representatives at 888-583-4007. Now, at this time, I want to go ahead and open up the floor for any questions. So let me go ahead and just look at our chat and see what questions we have so we can get that answered. Okay, so let's see. Okay, so of course we are being asked by Linda, we can get a copy of the presentation. Absolutely, I can go ahead and add it onto the chat. So let me do that now so you can have that available to you. And if you would prefer to unmute yourself and ask a question, you are certainly more than welcome to do so. We have about 15 minutes, so I will be on here for that amount of time to get any of your questions answered. However, if you prefer to visit our virtual booth, we do have our live representatives that would be more than happy to help you identify what plan would best work for your needs and go over those specific benefits. Are there any questions at this time? You're more than welcome to unmute yourself if you'd like. Okay, well, if there are no other questions, this does conclude our Medicare presentation. Again, we do invite you to visit our virtual booth. We will be there from 9 to 4 p.m. today. And again, if you prefer to even set up an in-home appointment to have a representative sit with you and go over your healthcare options, they would be more than happy to. I again appreciate everyone joining today's call.
Thank you so much, Eva. Linda said she couldn't see the link. Maybe you could post it in your virtual booth as well.
Okay, I will do that. I will go ahead and add that to the virtual booth. Can you see the
I can see.
Okay, yeah. Okay, perfect. Okay, so I'll go ahead and do that. Thank you so much for having us. It is a pleasure. Again, going over the benefit or going over what Alignment has to offer to all of you. I wish you all a wonderful rest of your day and have a great weekend.
Thank you so much.
You're quite welcome. Thank you everyone for joining.